Hey guys, welcome back to the channel. This is Sai Dental Vlogs and you all are welcome to yet another vlog. So many people are asking me queries regarding ki sir, whenever we are trying to do some new work, we are feeling much anxious, we are not able to do. Suppose we are about to do an extraction and suppose we are not confident in it and we are writing medications just to avoid the patient. You are just telling the patient to come after 3 days, 4 days and the patient may not turn up. So in the long run what happens is you may suffer losses because of this. So many people are feeling anxious even before doing any kind of procedure like root canal treatment and even if you are in college, even if you are doing in your second year or third year or final year BDS, while doing any kind of procedure, like suppose you are for a simple thing you are doing teeth setting, but many people are not going to the college itself, not attending the practical classes just because they are scared ki whenever they will do it, they won't be able to do it and the teachers will scold them. So if you have an attitude like this, you will never be able to grow up in life. You have to take up these challenges, right? You have to perform those. Up now, the basic things like we are eating, we are running, we are sleeping, we are walking. It's not learned from right from the birth. In the process we learn it, right? Similarly, things in dentistry, some people are able to do very nice work in one shot. Some people have to do it 100 times, then also they don't get it, right? So the main thing is whenever you're working, you have to work with full confidence. You don't have to think, okay, I may not do it correctly, but you have to do it, right? Because this is your bread and butter. So whenever you're feeling anxious, just let the moment pass off for some time. Think and relax, talk to your friends, take the help of your friends, your seniors and start. Suppose you're doing a tooth setting. So apart from the college hours, you can sit for half an hour extra in the lab and you can slowly you can practice. You can see some YouTube videos, very nice YouTube videos are there for regarding teeth setting. Similarly, in every dental procedure, you can see the procedure, how it is being done, you read about it. Slowly when you read about it and you get a theoretical knowledge of, suppose you are going to do a wisdom tooth extraction, right? So you are scared, okay, I may hit the nerve and the patient may get paresthesia, but once you read the anatomy, Snell's anatomy, and you read about local anesthesia from Cunningham's, so all those anatomy and all those about local anesthesia, when you're reading and you see, okay, where is exactly the canal located. Suppose you are scared, so you can also write a CBCT of the patient. You can see how far the lingual nerve is there from the third molar, how far the canal is there from the apex of the third molar. So these things you can assess, and when you are working, until unless you don't do that, fear will not go from your mind. We are always scared to remove the upper 6, upper 7. We know that whenever we break the tooth, then it will be very much impossible for us to take out. Why? I was also scared, but I confidently started doing, and I also used to break teeth. But see, that's how I learned now. Now I don't feel scared at all while doing upper 6, upper 7. Still now I am scared of doing horizontal impactions. I am also scared. It's normal human nature, right? Even you guys will get like scared whenever you will not think of impaction. But whenever I am also doing impaction, I am scared to some level, because I have already made a video in which I was stuck in extraction and I could not do it and I had to call one oral surgeon. You can watch the videos. The name of the video is I could not extract one tooth. Oops, the video's title is there. So you can see that video how I got stuck in that case. So wrong things happen with us also. We also make mistakes, right? So that doesn't mean that that's the end of your career, right? That happened with one patient and that was not your fault. Okay, so whenever we break a tooth, we should be very calm first and we should take a x-ray and see from where the root has broken. Then we should see what bone is lying around, and the first mistake what we do, we start blindly doing the procedure. We take the elevator and start rotating the elevator without seeing where the elevator is getting engaged. That may lead to more trauma, that may lead to more hemorrhage, and that may lead to more traumatic experience for the patient, psychologically as full painful. So first we need to take the x-ray and you see where the root is broken. And if you are not confident, just tell the patient ki I'm going to call a oral surgeon because the tooth was very difficult to remove, so you have to wait for much time. So you can call any nearby oral surgeon. If you are not present, if any oral surgeon is not there in your particular area, then you can always, instead of trying too much, you can tell the patient ki okay, see, this tooth was it's broken by me, I'm really sorry, I will refer to a higher center where it can be done easily. So it happens, like, you have to do it. Suppose if you want to do it on your own, at that time you have to learn some techniques that will come with experience. And what I do is, I see where the tooth is broken, I clean the area nicely, and I see where the root is broken, and that area I let cut little bit of bone, and using the Warwick James elevator I extract those kind of tooth. Earlier I was also not proficient. How? After BDS immediately I got into MDS, and in oral medicine, we don't do extractions. So when I opened my clinic after my PG, so that also after 2 years of doing PG, means total after my BDS I finished in 2009 and I finished in MDS in 2012. So I opened my clinic in 2015. So at that time, 14, sorry. So at that time, so much gap was there, and general dentistry was lacking behind. So I only developed it slowly. I slowly started doing things, and now I have learned almost everything. Not I will tell that I have 100%. Nobody's 100%. 75 to 80%. Yeah, you can say. So that also at this level you are at a beginner stage, and even if you are in third year, final year, second year, first year. So first year में भी आपको anxiety होगा कि ब्लॉक स्क्वायर नहीं बन रहा, मेरे लिए डेंटिस्ट्री नहीं है, मैं डेंटिस्ट्री नहीं कर सकता या कर सकती. दैट इज टोटली अ रॉन्ग नोशन. ओके, डेंटिस्ट्री इज समथिंग डिफरेंट, एंड डोंट बी एंशियस. सबके साथ होता है, ऐसा नहीं कि इट्स ओनली विद मी. Even the biggest of the oral surgeons, biggest of the endodontists, biggest of the prosthodontists, they get failures, right? So anxious is a good thing. If you are getting anxious, that means you are working, you are trying to improve, you are trying to learn something new. Doing anything new, you will feel anxious. Suppose you are going to go to some expedition all alone, so you will feel anxious. Okay, where is the road? How will I get the bus? And how, from where I will get the taxi? This is the same thing with dentistry. What if I break the root? What if the patient gets hematoma? What if the patient gets swelling? So as per experience, as the time grows, you will grow up with it, and don't get anxious. Easily you can do all the work. Have some confidence. Just do the work. Keep on doing. Keep going. Keep working. Right? So take care. Love you all. I hope you like this video. Please give a like, thumbs up, and you can also subscribe to this channel and press the bell icon, and you can join me as well by being a member of this channel. And you can also join me on Instagram, Sai_dental. I regularly make videos in Instagram, but this current 1 month I am not making regular videos as I'm busy with something. So I'll make a particular video about that also. And a new endometer video is also coming up. So let's hope all is going on well. Take care. Bye bye. Love you all.